afternoon, Miss Reeves. How are you doing today?
I'm good. How are you?
I'm doing well. My name is Leah, and today I am going to be brushing your teeth.
Oh, that is such a blessing. I believe it's been a few years.
Oh, my Lord, don't tell me no more. Well, let me just go ahead and set up everything. First, I must put on my gloves. I would like to go ahead and make sure that your bed is locked and lowered. So I'm just going to press down right here, and your wheelchair is locked right there.
Yes.
I'm going to pull this curtain. I'm going to go ahead and put on my gloves. What do you think about this coronavirus?
Oh, it's a story now.
I tell you,
It's a story. These
it's
children,
uncharted.
yes, uncharted territories, and these children have never lived through something so tragic because they weren't even born when the planes crashed into them Twin Towers. Do you remember that?
I do remember that. I tell you, it's a time. I have a wipe here because we're gonna wipe your mouth off at the end.
Okay.
I do have a little barrier. This is what I like to put down just so I don't contaminate anything. And I see we have your toothbrush. You are sitting upright. If you were laying down now, Miss Reeves, I would like for you to sit up, but this is a Fowler's position. So I am going to just moisten your toothbrush since I don't have a sink right here.
I wonder how you'd brush somebody's teeth if they were unconscious.
Ma'am, that is a great question. We would not brush someone's teeth with an actual toothbrush like this. We use what we call a little toothlette. You do want to moisten their toothbrush, moisten their mouth at least every at least every 2 hours, because you don't want them getting any sores or anything. And it just helps with comfort measures, but not a toothbrush and water like I'm fixing to do for you.
And what if they can't sit up?
And if they can't sit up, then you would still do that because you don't want them to aspirate. You could turn their head to the side.
Okay, that's good.
Any more questions?
No, ma'am.
Okay. Well, I'm going to get you to hold this emesis basin
Okay.
for me. And I am going to have you to open your mouth. And I'm going to start with a circular motion. And we're going to go on the bottom. And get that toothpaste right there. I lost it. Get all the surfaces of the teeth. Now, if at any time you need to spit, you just let me know. You okay? All right, let's get on the top. Oh, excuse me. Would you like to spit? All right, say cheese. Very, very good. Now,
I have horse teeth.
you have horse? No.
They're big.
Now we need to get your tongue. Now I'm not going to gag you. There you go. You know the tongue is a powerful weapon. Now if I could get you, would you like to spit or would you like a sip of water? Spit. Okay, go ahead, honey, go ahead. Very good. Watch your hair. Now would you like some water? I will help guide that cup to her mouth. Watch her spit. Very good. Now would you like any more water?
Okay.
All right, I'm gonna take this wipe. Take care of you first. Wipe that mouth off.
Thank you.
I'm gonna rinse the toothbrush just a little bit at the basin, at the bedside. Stick it in here. Now, hopefully that does not turn over. All right, I'm gonna take all this with me. This would go in my dirty hamper. See it right here? In the hamper. Now, I'm gonna leave you sitting up and I'll come back and check on you in a little while if that's okay with you. I am gonna give you your call light. Here you go.
Thanks.
If you need anything, don't hesitate to call me, okay? I'm gonna undo my privacy. Your bed is still locked and lowered. And I'll be back to get you settled, okay?
Okay, thank you.
So I'm gonna take all this over here very carefully. Because you're not done yet, people. I'm gonna dump this out, rinse the basin, and I'm going to, excuse me, back up just a little bit. I'm gonna rinse the toothbrush, stick this back into the cup. With the emesis basin, we dumped it, we rinse it, and then you're gonna dry it with a paper towel. And you're gonna place all of this in the dirty, contaminated area. And this is a dirty, contaminated area. And you just put all of this right here. Take off your gloves the right way by pinching on the inside, pulling off, not touching your skin. And then you're going to throw it in the trash. And then always verbalize, wash your hands. The end. Good. Come in.
Good morning, Miss Owens. My name is Miss Reeves, and I'm going to be washing your foot today, okay?
Oh, good.
All right, I'm going to put my stuff down on this bedside table, this overbed table, and I've got to go get some water, and I will be right back, okay? Here's your call bell. All right, your bed is locked and lowered, and you have privacy, of course. I'll be right back.
All right. Hurry up now. I don't have all day. Come in.
All right, Miss Owens. I'm back with your water. It feels good to me. Will you feel it, please?
It's all right.
Okay, I'm glad. All right, I'm going to put that on the floor so I can put my water on it. This is a little more difficult not being in the classroom.
I'm glad you got your PPE with you today.
I do. Okay, I'm going to spread this towel out so we can have a barrier.
Now don't judge my toes. Top Nails has been closed for quite some time.
All right, I'm gonna have you put your foot in the water.
Whew, that feels good.
I'm so glad.
And then my foot is submerged in the water.
Yes, it is submerged and I have wet it. All right, now I'm going to ask you to pick your foot up and I'm going to move the water out the way. And I'm going to wet my rag. I'm going to put my soap on the rag. No bubbles in our water. I'm going to hold your foot up gently and I'm going to wash it.
Yes, support it now. I've had arthritis in the ankle before.
I feel it. I'm going to get in between each toe.
You might can go work at Top Nails.
You know them children gonna love this. Okay, I'm gonna put it back in the water to rinse it. Making sure I rinse thoroughly in between each toe. Okay, I'm gonna lift it back out of the water. Now I'm going to dry your foot. Making sure that we dry in between each toe. Your toes look a lot better than mine do, ma'am. Okay.
Thank you.
Welcome. Now I'm going to apply some lotion. And we're going to go about halfway up the foot, getting your heel real good. But we cannot put lotion in between your toes because it causes moisture to build up. We don't want any bacteria to grow up in there.
No, that's germs.
But I'm hitting a pressure point there. You know, it helps relax you. Okay.
Honey, they could use you up at Top Nails.
All right. So I'm going to hand you your call bell. And let me put your foot back down in your shoe. Here's your call bell. Your bed is still locked and lowered because you're sitting up on the side of it. And I'm going to open my curtain. This is going to go in my soiled laundry. I'm going to take my pan and go rinse it out and dry it. And then I'm going to put my pan and my soap and my lotion all in the dirty soiled area. And then I'm going to take off my gloves. And then I'm going to wash my hands. Done.
Good job.
Now she gets to brush my teeth now.
All right, stop.